Hey cuties, welcome back to this series on vulvas and vaginas. I am your hostess, Tiernan Embron. I'm a correspondent for Killer and a Sweet Thing, sex educator, pleasure educator, currently in grad school to get my master's in public health, and the focus is going to be on sexual and reproductive health, so I know what I'm talking about. Anyway, moving right along. If you have been watching this series, then you know that I've been talking all the different topics that go along with vaginas and vulvas, starting with, anatomy, and we talked about pleasure and safety and menstruation and all that good stuff. But as I introduced in the episode directly prior to this one, the next few episodes are focusing on common issues or common problems associated with vaginas and vulvas. Last week I talked about urinary tract infections, UTIs, and this week we're going to be moving along to the next common vagina issue, which is bacterial vaginosis, also called BV, and also called vaginitis. So 3 names for one horrible problem. No, it's not horrible, it's just annoying, but it's super easy to treat, as the name suggests of this series, common, so don't trip if it happens to you. Now, if you do remember from the last episode, I'm talking about the who, the what, the when, the where, the why, and the how of these issues, so you get just the full scope of the problem, but also the full scope of the solution. Anywho, so who gets BV? Well, it's kind of in the name, right? Vaginosis, vaginitis. People who have vaginas get bacterial vaginosis. Those of you who have penises, you get off easy. All right, as you usually do, honestly. What is it? BV is a bacterial infection, which UTI is also a infection caused by bacteria, but it's caused by a bacteria that originates from outside the body, right? BV is caused by bacteria that already exists inside the vagina, healthy bacteria. So that kind of covers the what and the where. But the why. Why does this happen? If there's already healthy bacteria inside the vagina, why does it cause an infection? I will tell you. So, the vagina is based on a very delicate balance of pH. The vagina is based on a very delicate pH balance, and any number of things can mess with the chemistry of that. And when that happens, the healthy bacteria that exists in there tends to overgrow, and an overgrowth of bacteria is going to cause an infection, and that's BV. So when does this happen? When does this overgrowth of bacteria happen? Well, it can happen for any number of different reasons. A lot of different things can set off the balance of the pH balance of a vagina. Like I said, they are persnickety little things, but most common ones are like vaginal douches or like vaginal washes. Yes, they might make your pussy smell like a beautiful flower, but the thing is, your pussy isn't supposed to smell like a flower. It should smell like a vagina. And when you introduce these washes that are made with different fragrances or different dyes or different chemicals, it messes with the natural pH of your vagina, which causes the bacteria to grow, and there you have it, BV. Another common one is semen. So if you're having sex with someone who has a penis and they ejaculate inside you, that can really mess with the pH balance of your vagina, and it can lead to BV. So that covers the who, what, when, where, and why. Let's move on to the how. How do we treat it? Well, like most other common vagina issues, you gotta go to your doctor and also get an antibiotic similar to a UTI, and that should put your vagina, your out of whack vagina, back into whack. You can't get it over the counter. You have to be prescribed this antibiotic, unfortunately. So give your doctor a ring, make an appointment with Planned Parenthood, but that's pretty much the only way that you can treat BV. Let's see, how to prevent it. Well, if you're having sex with someone who has a penis, have them wear a condom, because like I said, semen is one of the major contributing causes, or excuse me, semen is one of the major causes of BV. So if there's no semen, no BV. Don't use any of the vaginal washes or douches. Just wash with, warm water and soap. Keep it simple. That should pretty much, keep BV out of your V. But there are some people who get chronic BV, which, once you have BV, sometimes it can just be really hard to get, the pH balance or the bacterial levels in your vagina back to where they started. So, maybe you take the antibiotic and it gets rid of all the bacteria, and then you get, sometimes taking an antibiotic takes out all of the healthy bacteria in your vagina, and then it causes an overgrowth again when it's trying to make up for that lack of bacteria, and then the overgrowth causes, the BV to come back. So it can really just be an endless cycle of BV awfulness. So if you have chronic BV, go in and talk to your doctor, go to your Planned Parenthood clinician, and they can tell you, or they can prescribe you something to help keep that chronic BV from being chronic. So to recap, who? People with vaginas. What? A bacterial infection. Where? Inside the vagina. Why? The pH balance or the bacterial levels in your vagina get thrown out of whack when any number of reasons, ranging from semen to vaginal washes to douches, throw it out of sync and causes healthy bacteria to overgrow. How to treat it? You gotta go to a doctor and get an antibiotic. Oh, I forgot. You can take some of the antibiotics orally, or they can prescribe you a gel that you insert into the vagina. I don't like that one as much. I find it's kind of annoying and gross, but to each their own. And how to prevent, use a condom, don't use vaginal washes or douches, or get boric acid pills and just insert those puppies after you have sex. Yeah, so there you go, folks. Next time we're going to be talking about yeast infections. Get ready.